I'm delighted to present the new Royal College of Occupational Therapists Improving Lives, Saving Money campaign report, Occupational Therapy, Unlocking the Potential of Children and Young People. This has been developed following a period of consultation with occupational therapists in all 4 nations and conversations with children and young people, parents, carers, stakeholders and others. As a society, we want our children and young people to live happy and fulfilled lives, managing the occupations that are important to them at home, at school and in their leisure time. We want children to realise their potential, developing the skills and resilience they need to access education and perform activities of daily living as children and adults. And we also want them to participate as valued members of society, regardless of any physical, learning or mental health needs. But childhood is changing. More children are starting school without the foundation skills and resilience they need to succeed in education and life. Some people would also say that we're experiencing a child mental health epidemic, with mental health problems affecting children and young people's health, well-being and success in childhood and as adults. Children and young people with special educational needs are increasing. Whilst we have an expectation that they will have access to the same opportunities and experiences as their peers, many experience an inequality of opportunity and are unable to access the support they need to realise their potential. Occupation is important for children's development, health and well-being. As occupational therapists, we enable children and young people to participate in and successfully manage activities at home, at school and during their free time, and we have the skills and expertise to identify the personal, task and environmental factors that support or hinder their development, participation and achievement. The Royal College of Occupational Therapists is therefore calling for services to be designed so that there is a better balance of provision at universal, targeted and specialist levels, and more collaboration between health, education, social care and the voluntary sector. This will require a shift in resources from specialist interventions to prevention, early intervention and partnership approaches, but doing so will ensure that occupational therapy resources are used wisely. It will extend our reach so that more children and young people benefit from occupational therapy, and will build the capacity of others to identify and support children and young people with additional needs and know when to refer on to specialist help for more specialist intervention. It will also prevent problems from escalating by intervening early so that fewer children and young people need specialist interventions and those with the most complex needs and circumstances can access occupational therapy quickly. In this report, we have identified 3 outcomes and make 5 recommendations. The first outcome we want as occupational therapists is to equip children and young people to live full and happy lives. We will achieve this by embedding opportunities to promote physical and mental health into children's daily routines and activities. Occupational therapists in NHS Tayside have developed a workshop for parents, carers and nursery staff, promoting the motor skills that underpin handwriting so that children have the pre-writing skills they need when they start school. While in North Belfast, occupational therapists have developed a whole school preventative programme to support students' mental health and well-being. The second outcome for occupational therapy is to equip children and young people to realise their potential by developing partnerships to build community capacity and address needs early on. Occupational therapists in Camden have adopted the Partnering for a Change model of service delivery, working alongside teachers to enable them to identify children who are struggling and to implement tools and strategies to support their performance, meaning that children access the help and support they need when they need it. We will also achieve this second outcome by working across traditional service boundaries to address children's physical and mental health. In Devon, an occupational therapist is working as an education wellbeing advisor, supporting children and young people who are at risk of being out of school or who are unable to access full-time education by thinking about the physical and emotional needs to preventing them from accessing school. We will also achieve this outcome by adopting a strengths-based approach that fosters self-management and independence. In Swansea, occupational therapists are working in the neonatal intensive care unit, enabling parents to support the physical and cognitive and emotional well-being of their children. The third occupational therapy outcome is to equip children and young people to participate as valued members of their community, and we will achieve this by anticipating the changing needs and facilitating positive transitions between services and settings. Occupational therapists working for Warrington Borough Council are supporting a young lady moving from hospital to home, identifying suitable housing to meet her current and future needs and those of her family. Whilst in Solihull, occupational therapists are supporting a young man who has been out of education for mental health reasons for some time, enabling him to make the transition to college, providing him with hope and skills for his adult life. We hope that you will use this report as occupational therapists to reflect on your practice and think about what you can do to ensure children and young people receive the right help at the right time. We also hope that you will use this report to start conversations with commissioners and others to promote the value of occupational therapy and to highlight our role in enabling all children and young people to unlock their potential.